Do you have high blood pressure? Do you want to protect your kidneys? If so, please watch the video until the end. Hello, this is KHealth. Today, we will explore how high blood pressure affects the kidneys and learn about ways to control blood pressure and protect the kidneys. First, let's examine the relationship between high blood pressure and the kidneys. The kidneys regulate blood pressure through the renin-angiotensin system. I will provide more detailed explanations about this system later. The kidneys also eliminate waste and maintain the overall balance of body fluids. High blood pressure puts pressure on the tiny blood vessels in the kidneys, which can lead to vessel damage, narrowing, or blockage. The glomeruli, which are the filtering units of the kidneys, can be seen as clusters of tiny blood vessels. If they are damaged and do not receive nutrients and oxygen supply to the kidney cells, the glomeruli can become impaired. Persistent high blood pressure accelerates damage to the glomeruli, leading to more severe proteinuria. The amount of proteinuria greatly affects the prognosis. If a significant amount of proteinuria occurs, it often worsens to a severe stage when AGFR drops below 60. Therefore, it is crucial to manage blood pressure to protect the kidneys. How can we lower blood pressure to a normal range? First and foremost, blood pressure needs to be systematically managed. Regular blood pressure measurements should be taken, and blood pressure should be controlled within the normal range. Taking medication, if necessary, is also recommended. Adopting a healthy diet is essential. Salt is necessary for our bodies, and recent studies have shown that low-salt diets may actually increase the risk of cardiovascular disease mortality. However, it is clear that excessive sodium intake beyond the recommended range raises blood pressure and increases mortality rates. This data shows the percentage of deaths from cardiovascular diseases based on daily sodium intake. Consuming more than 8 grams of sodium and following a high-salt diet has the highest mortality rate, followed by low-salt diets. Refined salt can significantly raise blood pressure, so it is best to avoid it. Instead, consume seaweed, fresh vegetables, and fruits. Thirdly, weight management is important to improve blood pressure and abnormal lipid levels. Weight management is necessary. Obesity indicates that excess fat has accumulated. Therefore, conditions that narrow and block blood vessels can occur. Especially, you need to pay attention to waist circumference management. Even those who appear slim may have concerns about hidden abdominal fat. There is a research paper that analyzed the relationship between waist circumference, hypertension prevalence, and the National Health and Nutrition Examination Survey from 2007 to 2018. A total of 27,894 American adults were surveyed. Body mass index (BMI) did not always show a consistent association with hypertension prevalence. However, in the case of waist circumference, regardless of underweight, normal weight, overweight, or obesity, a strong association was found. Controlling waist circumference is essential for blood pressure management. Smoking and excessive alcohol consumption should be avoided. I won't go into further explanations on this. Fifth, it is important to manage stress that raises blood pressure. We can't live without stress, but we can manage it. Meditation can help alleviate stress. Sixth, engage in regular exercise at least 3 times a week. Exercises that require excessive force or sudden weightlifting can actually increase blood pressure, so they are not recommended. It is beneficial to engage in moderate intensity Aerobic exercise for about 30 to 40 minutes, where you feel slightly out of breath. Exercise promotes smooth blood circulation and ensures adequate oxygen supply to the heart, stabilizing blood pressure. 7th, take vitamin D supplements or expose yourself to sunlight. Low levels of vitamin D make it easier for hypertension and depression to occur. Sufficient sun exposure allows vitamin D synthesis. However, nowadays many people mainly engage in indoor activities, and air pollution is also serious, resulting in a widespread vitamin D deficiency. Lastly, it is advisable to avoid places like saunas or steam room. Today, we briefly discussed the relationship between hypertension and the kidneys, as well as methods for managing blood pressure. In the next session, we will explore hypertension medications that affect the kidneys. Thank you. See you next time. Take care and have a happy day.